recent paper published looking at the role of Daratumumab post-allogeneic stem cell transplant in myeloma. And allogeneic stem cell transplant in myeloma represents a controversial approach, both in the US and ex-US. Although I think ex-US there is probably a little higher role for it. If you look at some of the data for tandem auto-allo and some of the favorable nature of that for young patients with very high-risk disease, institution by institutions differ quite a bit. But some institutions, and I've been in several of these, that use allogeneic stem cell transplant as a modality of long-term disease control, if not cure, for younger patients with high-risk disease. The difficulty is that there is really no data that's been published about how to manage post-allo relapses. The unfortunate thing is that even though many patients will survive that first 100 days in terms of transplant-related mortality, ultimately there's a risk of relapse. And one of the things that came out of a meeting once, I was sitting around, at the time I was at Hackensack, and I was sitting at an advisory board with Amrita Krishnan from City of Hope and Dr. Hari Parmaswani from Medical College of Wisconsin. And we were all sitting around talking about the role of Darzalex post-allo relapse. And we'd all confessed that we have been doing it without really any knowledge of what we were doing, just a feeling, as opposed to classical chemotherapy or cytotoxic drugs or lenalidomide, which may worsen GvH and may lower your blood counts. We wanted to take a look at this. So we formed a little group of the three of us and put together and evaluated our entire cohort of patients receiving Daratumumab post-allo. And it was retrospective. But I think one of the interesting things we found was that we're able to recapture disease in many of our patients through a variety of dara-containing regimens, with response rates ranging from 30 to 40%. And without inducing worsening GvH. And again, one of the big concerns in the post-allo setting is with whatever therapy you give, can you worsen GvH from not necessarily a mortality standpoint, but morbidity? And we found is that Daratumumab did not exacerbate that. So our hopes are that for patients who still receive allogeneic transplants and relapse, here at least is some data for their clinical teams to stand on to approach their post-allo relapse with a Darzalex-based therapy.